Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we are going to talk about paranoid personality disorder. Now, paranoid personality disorder is one of the 10 personality disorders in the DSM-5. There are some other personality disorders that were considered but did not make it into the manual. So we're going to focus on the 10 that did. So let's start with the first one, paranoid personality disorder. So the hallmark feature of paranoid personality disorder is suspiciousness or distrust. And it's important to understand that this distrust is not really, or suspicion is not delusional. So it's not so bizarre and so firmly held that it separates the person from reality. But there are significant suspicions there. And as a result of this mistrust, people with paranoid personality disorder kind of are cold and distant and aloof. They stay away from people to avoid someone harming them. So, but the DSM5 criteria, we require 4 out of 7 of the following criteria. A person has to believe that other people are either using, lying them, harming them without evidence. They have to have doubts about someone's trustworthiness or loyalty. They refuse to confide in people because they're afraid that their confidence will be betrayed. So it's, quote, none of your business or their business. They interpret neutral or benign remarks as harmful or threatening. They hold grudges. They believe that their reputation or character is being attacked by others, even if there is no evidence for such, and will retaliate based on that. And this jealousness or suspiciousness can occur in the form of romantic partners thinking that a romantic partner is unfaithful. Now, you don't need all 7 of these. All you need is 4 out of 7. Now, criterion B is to exclude other conditions. So if we're going to diagnose a person with paranoid personality disorder, it cannot be due to some kind of psychotic episode, schizophrenia, bipolar disorder, or depressive disorder with psychotic features. As with all personality disorders, this is considered a relatively stable condition. So this disorder is going to manifest for your whole life, but the minimum time frame is 6 months. Okay, so what are some other important points about paranoid personality disorder? Very sensitive to criticism, but very motivated to point out the faults of other people. And if something goes wrong, they oftentimes deflect blame on other people or bear grudges, as I said on a previous slide. According to the latest DSM statistics, we estimate somewhere between 2.3 to 4.4% of US adults are believed to have this condition. Now, I have seen low estimates to 0.5%. So the range is broader than I'm reporting on the slide, but because in the DSM-5 it reports 2.3 to 4.4, I'm reporting that number. And it's more common amongst males relative to females. So how do we explain the development of paranoid personality disorder? Well, there are 3 common explanations, all of which have insufficient evidence to support them, but are hypotheses nonetheless. The psychodynamic theorists suggest that it could be that you had overly demanding parents and overly punitive parents, so you became concerned about retribution or punishment, and that fearful nature occurred as a function of that. From a cognitive point of view, it could be to some maladaptive thought or a maladaptive assumption, which is an irrational belief that's not substantiated, And one example of one of these maladaptive assumptions are people are generally evil and will attack you given the chance. Not the only type of cognitive thought disturbance, but nonetheless, that is one good example. And from a biological point of view, we look at genetics and we look in families and twin studies to see the relationship. And there are higher rates to some degree within families that have a diagnosis. Now, how do we treat paranoid personality disorder? The simplest answer is most of the time we don't, because a person with paranoid personality disorder is going to not likely come into treatment. They are going to avoid treatment. So they are going to be suspicious of a clinician because the clinician might harm them as well. So they're not coming into treatment willingly most of the time. And those who do come into treatment oftentimes rebel against the therapist, don't trust the therapist or whatnot. So treatment for paranoid personality disorder is very limited in its effectiveness. And you have to be very patient because it moves slowly. But if we are going to do treatment, we have to have a roadmap. Well, if we think about psychodynamic principles, the object relations therapists are going to try and see past a patient's anger because they're just projecting that onto you. And you're going to ignore that so that you can get to the underlying goal or desire to have a meaningful, satisfying relationship. And if we have to uncouple the fear of punishment and retribution that they might have experienced in early childhood. We have to ignore that. They might project that onto us or transfer that onto us. But if we can see past that, we can help them. From a behavioral and cognitive point of view, we're going to focus on thoughts and behaviors to regulate anxiety and improve interpersonal skills. So let's take the maladaptive assumption that people are generally evil and want to harm you or will harm you given the opportunity. We would try and restructure that to, at a minimum, I don't know the nature of this person, so I'm going to remain neutral in stance. Or we can use evidence to disprove that people are evil, and you could show all the people that are actually good in their life. So this is kind of pushing back or challenging the maladaptive assumptions so that we can get to a healthier interpretation. Now, what about drug therapy? If we say there are biological origins, there aren't many good pharmacotherapeutics for paranoid personality disorder. We can use pharmacology to treat features around the condition, but typically drug therapy is of limited help. So that is a very brief synopsis of paranoid personality disorder. In our next video, we're going to talk about something called schizoid personality disorder, which focuses on a person who's more distant or reclusive, kind of stays to themselves. But I hope you found this video enjoyable. I hope you learned something new. And if you did, give me a big thumbs up. Click the subscribe button, click the notifications tab, and please put something in the comments. I read and respond to every comment. Until next time, everybody, take care.